All right. Hey, everybody. Sorry for the delay. I apologize. I'm Dr. Roney. We had some things going on downstairs that I had to attend to, and Dr. Connealy is still seeing patients. So totally apologize for the delay. So anyway, welcome. We'll get started. I will spend a little extra time on the back end because we missed some of the front end. So I want to take the opportunity to welcome you to the cancer conversation. Dr. Connealy will be up in a few minutes, and then we'll get started on the question and answer session. But wanted to welcome you. If you're new to the cancer conversation, again, I'm Dr. Roney. Dr. Connealy will be here shortly. Want to welcome you. And then if you've been on, and I know a lot of you tune in weekly or every other week when we have these. So again, appreciate you coming on, appreciate you being here. Certainly appreciate the feedback that we get consistently. So I just want to say thank you to all of you for a lot of the support and the feedback. I think one thing that we talk about, and I don't want to be redundant with some of these points, but when you're downstairs, and we're upstairs, but downstairs to do these cancer conversations, but downstairs on the floor, the things that we see on a daily basis really, gosh, make us think and make us, I guess, more convicted in the process, but also more convicted in the idea of wellness and prevention, right? And I know you hear me say that a lot, and I know you hear that outside of here quite a bit, but I mean, just in the last week, I could tell you we had, just as an example, 30-year-old colon cancer patient with mets to the liver, right? Just talked to a patient today, 20-year-old ovarian cancer patient. So the point I'll make is we're seeing, that's just two examples. We see this consistently now, unfortunately, where it's afflicting younger and younger people. And, the idea being that I think our environment, right, is kind of mucked up, right? Using an M word, mucked up, in the sense that we have too many toxins, too many chemicals. Our food supply is really not up to par. Our stress levels are too high anymore, et cetera, right? And I'll go through that a little bit with you as far as some of these causes. But the point I want to make, when we're seeing it at younger and younger levels, the amount of metabolic dysfunction going on in the body, creating a great amount of cellular dysfunction, is significant nowadays. And so one of the things that I get asked that I wanted to talk a little bit about is the concept of needing potentially, some of these more aggressive approaches when somebody has cancer. And what I mean by that is chemosurgery, radiation, low dose chemo, immunotherapies, et cetera. Some of these more, I call them heavy hitters or bombs or atomic bombs. And the way I rationalize it with people sometimes is because, honestly, I'll be brutally honest, I came here because of a bad experience years and years ago with my father in this world. And what I mean by that is I think some of the treatments took him down before the actual cancer did. And so I was very adamant against a lot of those bombs or atomic bombs. And then when I came here, I realized that, well, they are needed quite often. If I'm being perfectly honest or brutally honest, they are needed quite often. But the reality is it's just one chapter of a 10 or 20 chapter book where we might need those, and I'll explain my thought on that. But if we support the human body and we support cellular function and we support the immune system and we support detox and all these great techniques and modalities that we now have, the person actually does much better than what I saw. And so my tone, if you will, has switched to where I would now consider doing something more aggressive. And here's why. And I think this is really important. And I think it makes sense. When we have a significant amount of metabolic dysfunction going on in the body, we have a lot of inflammation created by things like bacteria loads and viral loads. And we have inflammation created by, say, candida or fungal type infections from mycotoxins from mold, or again, candida, or we have parasites, or we have heavy metals or non-metal toxins, right? We have stress and hormone imbalance and methylation or epigenetic factors affecting some of our genes and the way they express. And we have EMFs, and we have bad food, and we have all this stuff going on. These are what create the metabolic dysfunction in the body, right? And then we get enough of that metabolic dysfunction creating what they call oxidative stress. If we have enough oxidative stress, it damages the cells. And sometimes there's so much cellular damage and so much cellular dysfunction combined with metabolic dysfunction of the body, we don't have enough time to fix this to get ahead of this, right? And I hope that makes sense. So sometimes there needs to be this intervention, via maybe an atomic bomb to slow the process down to give us time to clean up the body so the body can do a better job of doing the work. So that's my rationale. That's what I've learned over time. I like to express that. I like to articulate that because I think that's rational, right? Where I know we have a lot of people out there probably listening to that would want to do things all natural when it comes to a chronic illness like cancer. But the reality is sometimes, and a lot of times I will say, there's so much dysfunction in the cell, complemented, if you will, by so much dysfunction in the body. Something has to give. We need something to slow the process down. So anyway, I hope that makes sense because to me, that's the justification of me making the 180 where I go, I get that. As long as we're doing the other chapters of the book to support it, where we're oxygenating the cell, we're alkalizing the cell, we're charging the cell, we're also immune boosting and looking at the intracellular nutrition, and we're doing detox and lymph drainage and, all these great things to support it and support the body and the cellular function while you're going through something like that. I see it work really well day in and day out. Okay. And then also when you get into the nitty gritty about fixing causes and be able to clean up the environment, now we're talking about a full plan, maybe using starving the cancer, killing the cancer, supporting the cellular environment, and supporting a person through that process with all the things that I just talked about. And we're cleaning up bacterial loads, viral loads, pathogens, like candida and parasites and metals and toxins, and getting their stress, pathways as far as hormones and cortisol regulated, and we're fixing epigenetics and methylation, et cetera. Now all of a sudden, we're starting to win with a plan and a focused plan that works really well. Okay, so that's kind of give you an insight on the 4 pillars, although I didn't go over it, directly. But going back to my original comment, the same things that are going to heal somebody from a chronic illness or cellular dysfunction like cancer, or what cancer, pretty much the outcomes or the byproduct of it is that cellular dysfunction. But the same things that are going to help somebody rid the body of cancer and create that homeostasis or balance in the cell and in the environment is going to prevent it. And so I think we need to do a much better job, us in the healthcare world, of promoting the preventative part. So I read one time, and this will be pretty interesting, but I looked at the hierarchy of needs. The psychology books, put the hierarchy of needs, and of course, food and shelter and things like that are at the top. And the last time I looked, health was like 10th, 11th on the list. It was way down, or prevention or health and such. Aesthetics was way higher, right? Making sure we're looking good on the outside. So the point I want to make is I get it that a lot of people don't really respond to something or act until there's actually a crisis. And so I can tell you the word regret, right? This is what we hear every day, which makes us more convicted on a day-to-day basis with our preventative protocols is regret. A lot of the patients will say, I wish I would have known about the preventative part sooner. I was fairly healthy. I ate clean. I did my exercise. I took my supplements, and I fall into that category as well. And yet I still got cancer. And then when we start digging and they start learning about the causes where they're not methylating well and their stress levels were out of control, both emotionally, physically, and chemically, and they have these infections in the body. Once we start unraveling that, they're like, oh my gosh, I wish I would have known to take the deeper dive sooner. So again, I'm promoting that because of just even these two cases that I just mentioned, a 30-year-old with colon mets to the liver and a 20-year-old with ovarian. Like, gang, that's unbelievable. It's like, how is this stuff happening? Well, it's happening because we're just overwhelmed with all those things that I talked about from a cost standpoint. And there's a bunch more, but I just wanted to give you that idea. So I really want to empower you all with that information and give you some incentive and motivation to find a place. If it's us, great. Come in, talk to Miles, 680. He's the 680-1880, 949-680-1880. And he'll guide you on our preventative or proactive protocols. I recommend it highly for everybody without question. So, and I just wanted to touch on that because, again, it's too important to let that go on a week-to-week basis. So I definitely wanted to make sure that I articulated that. Okay, so now Dr. Connealy will be up. We'll share the screen. We'll start going through questions. But I did want to touch on one other thing that it's a little bit of a mountain to cover, but I just want to touch on it while we're still waiting for Dr. Connealy to come up. And that's this process, something called epigenetics, right? Huge. Okay. So I'm going to explain it simply right now, and then we'll do a couple of these classes on epigenetics moving forward. But epigenetics is basically this. We are born with gene mutations, right? Mutations in certain genes. And I'll use the most common one out there is called the MTHFR gene. Okay. And these mutations could either be a single mutation where we get one from mom or dad, or these genes could be double mutated, where we get one from mom and dad. And so the reality is when we have these mutations, it will reduce the enzymatic activity of that gene up to 80%, which means if we're using MTHFR, which a lot of you may be familiar with, but if you're not, this is a gene that's helpful with detoxification. They call it methylation cycle of detoxification. It has many, many ramifications if it's not working well. The point I'll make is if this MTHFR gene is affected, right, and say it's double or single mutated, and the enzymatic activity is reduced significantly, you will need certain B vitamins to be able to overcome that or bridge that gap. One of them is methylated B9 in the form of methyl tetrahydrofolate. Not important that you understand that, other than if we don't know that you're not methylating well because you have these dirty genes or these gene mutations, then we won't know that you're B9 and you need methylated B9 to actually perform a function within the cell. If you're taking regular Bs, it doesn't get into the cell real well, so it doesn't allow for intracellular function. So these epigenetic factors can affect inflammation. It can affect the way you process hormones. It could affect the way you detox. It can affect your cardiovascular health, your brain, your sleep, your mood, all these different things. So the epigenetics is really, as far as the food chain or when we talk about health upstream, we really should know if you have any of these gene mutations from the get-go. So a lot of you, if you've been to the clinic, we do this cell science test. It's on the methylation pathway. It looks at MTHFR, MTR, MTRR, AHCY, and COMT gene. And that basically is the complete, not totally complete, but it's a pretty complete pathway for detoxification. They call it the methylation detox cycle. And there's a ton more, again, affecting inflammation, affecting brain health, affecting mood, affecting sleep, affecting detox, affecting, all these different processes of the body could be affected by these gene mutations. Now, real quick, I'm going to touch on this and then we'll move on because we'll come back to this for sure. But we could have these gene mutations. But say you and I have the same profile, have an MTHFR, we have an MTR double gene mutation and a COMT. In that pathway, we both have, you and I both have the same profile. I could function 100% even with those genes that are double mutated. You may have serious problems related to it. The difference is what's going on over here. They use the term dirty genes. So if your lifestyle or stress or infections or toxins or the way you eat or foods, you're overwhelmed here, they call it a dirty lifestyle, if you will cause those genes to express more or be inhibited more, meaning they won't work as well. So the enzymatic activity of the gene is affected more by the dirtier our lifestyles are, quite honestly. So we could have the same profile. I function great, you don't, or vice versa. It all depends, which means we can clean up those dirty genes by getting rid of, the stress response, the hormone balancing, or get the hormones better balanced, get rid of toxins, get rid of chemicals, get a better diet, get your gut healthier. All these different things will basically create less inhibition of those genes, and they will work better, which means the solution would be less. We need less methyl tetrahydrofolate, which is a form of B9, or less methylcobalamin, which is a form of B12, if everything is working well. So I think somebody asked, how do you clean up, or how do you get rid of those genes? Well, we clean up the lifestyle the same way that we would if you had a chronic disease. We're going to do the same thing, and indirectly, it's going to help those genes function better. So that's my quick. I've been wanting to talk about that forever, because as I've gone down the rabbit hole, it has been eye-opening as far as I think in the health world, if you will, it's significantly overlooked, and I think it's probably one of the number one priorities. Okay, so if you get into that, there's a really good book called Dirty Genes from a Dr. Ben Lynch, who does a wonderful job of articulating it. You can get it on an audio book, or read it, but I think that's a good one. There's a Dr. Dan Purser, who I follow, who does a really good job, I feel, of explaining it. Explaining some of these genes and when they are affected, what the symptoms are, what happens intracellularly to your inflammation processes, etc. So just wanted to touch on that while I had a little extra time. Okay, let me see. I'm going to go ahead and share the screen. All right, so Dr. Connealy she literally ran up here, but we're good. We went over the prevention protocols. We talked heavily about that. And gang, here is the slide that for the prevention protocol, as far as day 1, day 2, day 3, you hear me talk about this, every time we're on, but I made it a big point. I talked about the 2 patients, one 30-year-old with colon and liver mets, 20-year-old ovarian this week. Like, these are the things that we're seeing more and more of. And I know, Dr. Connealy, we talk about this all the time from a preventative standpoint, all the things that I'll let you slide over there. All the things that we need to do a better job of, us really, and articulating that vision of, look, we're seeing things more and more. The environment's getting more, I use the term mucked up, right? So we're getting these earlier and earlier cancers, which, look, if we can go down the rabbit hole, like the day 1, day 2, and the treatment options here, we can probably get ahead of this quite early if there is anything going on, and or prevent it.
Right. Yeah. Cancer rates are 1 and 2 and expected to grow 30% in the next 5 years. And so we just have to do a better job at prevention and early detection. And that's why we continue to do these cancer conversations. And it's not, and like my last 2 patients one was a heart patient, actually. She had a calcium score, and her calcium score. So what that is that there's testing the calcifications in the arteries feeding your heart. And so last year she was like 453. And so she repeated it and it doubled. So I said, oh, wow, so I ordered all this blood test and all the, extreme blood testing, and it's not cholesterol, because her cholesterol is only 150, which is considered, pretty normal, or actually on the low side. And so anyway, so we're just seeing things in, younger and younger people. We're seeing things that should not be happening, because I used to say we have a warranty until you're 40, and then you're on the semi-warranty 40 to 60, and then 60 up. There's no warranty, and it's just pure repair, upkeep, and maintenance. And so we have to now, though, we need to live a life of prevention. I had a young lady come in today She's 29 and she just had her first baby who's a year old. And she says, I want to make sure I'm really healthy for baby number 2, but I just want to make sure I don't have anything.
Mhm.
So she's the one I think you
Yeah,
did.
I just saw her.
You just saw
Yeah.
her.
Mhm.
Anyway, so it's so beautiful to see that she's 29 and she says, I just want to make sure I'm all good. And so I go, okay, good. This is like the best thing, when patients come in, because I always tell people it's so much easier to prevent than to treat. And so it's just whether it's heart disease, the top 3 killers are medications, heart disease, and cancer. So we're experts at all of those because we don't use that much medications. And heart disease we have down, and cancer we have down. So obviously we do autoimmune and everything else because that's all part and parcel of the picture.
Yeah.
But should
Way
we go?
less time, energy, and money.
Yeah,
Honestly,
exactly.
the money part too, it's the small investment for prevention, definitely deters the big investment later for curing. So we went over the 4 pillars.
Things that we addressed.
I touched on too, just because we had a little extra time, the whole methylation and the whole epigenetic, huge. I want to do a full couple, sessions on that, but I
Yes.
gave them the idea that these genes are expressing more and more, right? We've always been born with them, but they're expressing more and more because our lifestyles are dirtier and dirtier. So when they're expressing more, they're inhibited. And when they're inhibited, there's gaps. And so, gaps in being able to, combat inflammation, gaps in being able to detox, gaps in to be able to have good cardiovascular health. These epigenetic factors are impacting people in today's world way more than I think before. And I think that's pretty well studied. But that's a big factor that we'll definitely talk about. Okay.
Right.
So, all right, here's the first question. Let's fire away. So how does one know if chemo isn't working or is too aggressive?
Right. Well, a couple of things. Usually doctors will prescribe a cocktail of chemotherapy, whether that we do low dose or we do conventional dose. Conventional is 100% dose, and then low dose, we use 10% dose along with insulin to act as a Trojan horse to bring the chemotherapy into the cell. And so what we do is after 8 or 10 treatments, we'll order scans. Typically, that is also how the conventional doctors will do. They will order, chemo for so many months, and then they'll recheck a scan in 3 months to make sure it's working. And so you really want to know, is it working? Is there shrinkage of the tumors or the growths in the body? And if it's not, then the doctor needs to pivot to a new plan.
Mhm.
Okay. And a lot of times what I see is that they do the chemotherapy, but what happens is they continue the chemotherapy even though the scan doesn't get better. Well, that's not what you want to do, because every time you do chemotherapy, it's disastrous on the whole entire body, whether the immune system, the neurological system, the gastrointestinal system, the nervous system, and everything. So you want to make sure. Now, we do in the clinic chemosensitivity testing.
Great point.
And so we test to see what really works on the cancer. So in this day and time, we have so many other influential factors that it's probably best to know exactly what works on the cancer. So we do something called the chemo scale. The lab is called DATAR, DATAR, and it checks like 75 agents, not just chemo, but also natural things and medication that may work along with the chemotherapy.
And it's specific to the cancer cells in your body.
Right,
Right? It's
exactly.
very
So it's
individualized.
personalized just to
Mhm.
you. So
Yep.
we send your blood, and then we get the report about 3 weeks later.
And that one too looks at the repurposed meds too,
Yes,
right? The
correct.
chemo agents and repurposed meds for starving the cancer, which is now a huge, part of the plan, or should be.
Right, yeah, because they just came out with a study that for pancreatic cancer, using gemcitabine with ivermectin was far successful than just gemcitabine alone. And so we customarily use repurposed drugs with our cancer patients, maybe not on a stage 1 or 2 cancer patients, but if they're stage 3 and 4, we don't want to leave a stone unturned. So we just say, I always tell patients, we have to have as many healing pathways. Chemo is just one of the pathways to to kill cancer, but you've got to have all these other pathways developed, first of all, because if you're receiving chemotherapy, you're destroying every system in your body. So you must be, the person asks, is it too aggressive? Well, it's going to be too aggressive. Chemo is an aggressive agent. Okay. That's just what it is. And so
Support.
And so we have to do all the supportive, we give you things at home, and we give you, we here in the clinic, we do IV vitamin C with it. We do artesunate possibly along with it. We do alkaline IVs. We make sure that the cells have the proper voltage. Make sure we have oxygen therapies. We make sure the nutrients are on board, and we make sure the voltage, the cell's working. Because if the cell isn't working, how are you going to heal? Period.
Right.
And so
the HEPAR PK pushes that we do
Right.
to help detoxify, a lot of good supportive things to that cellular health to keep you, there's a term they use, catabolic, right? Chemo kind of breaks you down and breaks the cells down, like Dr. Connealy said. But if you do all these things, you can stay, you can
Ahead
stay
of the game.
strong. You can stay ahead of the game and almost be anabolic, where you're building as opposed to breaking down. Maybe not aggressively, but you can keep a good, healthy environment as best you can, even and getting the win out of the chemo, but not the downside.
Right.
And that's
So one of my patients today, she's 45 years old, and she has rectal cancer that's reoccurred, I think twice. Anyway, she's getting conventional chemo in her home in Virginia, wherever it is. Anyway, but she tells me that she's down for 1 week, and she's, then uses the next week to recover. So that probably is that the chemo is probably very aggressive, because she's only 45. She's not like she's 65 or 75. And so, in that patient, I'd say maybe we should do a lower dose, but there's no such thing in conventional oncology. I mean, sometimes there is, but most of the time there isn't.
They have their protocol.
They follow the protocol and don't really listen to the patient to say, oh, how are you doing? How are you feeling? And so forth and so on. And they give her Neulasta, which is the injection for bringing the white count up every time. So that causes a lot of also, negative forces to the body. So again, if anyone is getting chemotherapy, you must have a collateral support plan while you're doing chemo. Don't just rely on chemotherapy, because chemotherapy isn't 100% kill rate. If it's 50%, we're doing good. So you can't just rely on chemotherapy. So you have to have all your other healing pathways and fixing all of your blood work, which oncologists do not even check blood work. They check a chemistry and a CBC, and they don't check anything else. They don't check inflammation, your sugar levels, hormone levels, thyroid levels, DHEA, all the things that make your body work. And so they never check your immune system. You should have your immune system checked. So you should have all these things checked if a person is diagnosed with cancer, or if they want to do prevention, we should be checking all of these things.
The chemo itself is one chapter of a multi-chapter book. It could be a 10-chapter book, a 20-chapter book. So these other chapters are everything that Dr. Connealy's talking about. So yes, it may be needed, right? A lot of people do need this stuff, right? We've seen it. We're realists about that.
Well, we have to shrink to our burden.
Yeah.
So we use that as part of one of our pathways to healing. So
you just need the other chapters in the book to be able to do that. All right. So semaglutide, I know it's a biggie these days. What's your
so people ask me about this, and when patients ask me about that, I always say, well, have you done everything in your power to lose weight on your own, or with a physician, or with a health coach, or whatever? Because there's a lot to weight loss. And I know, because I started my practice 38 years ago with helping people lose weight. There was me, and I had a dietitian, but I also checked everybody's blood, and I checked all their hormones and everything. And so there's a lot to weight loss. And then, so the semaglutide, you need to know the good, bad, and the ugly. And I always believe that we should all be giving patients the informed consent of like what these medications do, or these peptides do. And so one of the things is, they can increase your risk for cancer. So you want to, know that going in. It also increases your risk for malabsorption because your stomach and your gastrointestinal system doesn't move. It causes gastroparesis. And if it's permanent, it can be a very, very dangerous thing. It changes your microbiome. It also, I just was reading an article like a week ago of how it changes like the brain chemicals and in the brain. So making the person more anxious and depressed and possibly suicidal. So I think, like, I know if a patient is, very overweight and they need that as a crutch, like in the beginning to get started, and if as long as you do, again, the collateral balancing of things to, one of the biggest things that it causes is complete loss of muscles. I have patients where they lose all their musculature in their face and then their whole body sags. And so because you're losing, well, we're already losing muscle. It's called sarcopenia. It starts in your, around 40. And so we don't need any help. So you got to make sure you're working out with weights 3 days a week. You got to make sure you're taking amino acids. You got to make sure you're taking things for your gut for the semaglutide. And I mean, got to make sure your nutrients are okay because of the malabsorption that it causes. So it doesn't come without downside. So I think, I know they're just giving it out to people, just as they see and not making sure patients fully understand, like, how are you eating? How are you moving? How are you sleeping? What's your stress level? Like, so if you have fatty liver, you can't lose weight very well. If you have high cortisol, you can't lose weight very well.
Low thyroid.
Low thyroid. If you have low adrenals, all these things impact your ability to lose weight. So I think anybody administering these, make sure they do a really deep dive into optimizing your entire system. So
sometimes the benefit wouldn't outweigh the risk for a lot of people is what my research has shown.
And it can't be, it's not the kind of thing forever.
Yeah.
Personally, I don't think you should be using this forever.
Right.
So.
All right. So beta glucan, is it for everybody, just cancer patient? Does it help any type of cancer?
Yeah. So beta glucan's been around for a very, very long time, and it's very good for all diseases. Okay. Because why? Because every disease is related to your immune system, whether it's your heart, your cancer, autoimmune, all diseases are related to your immune system. So this helps your natural killer cells. This helps your T cells. So it is there's no downside to the beta glucan. So, and it would help any time of cancer because you're helping the immune system. It has a very long history. There's many, I forget how many studies on beta glucan, but a lot of studies on beta glucan. Yes.
Good,
exactly.
Definitely a good one.
A good question.
Yeah. Immediate side effects of radiation to resolve cancer that's on the bone, breast cancer that metastasized to the bone. What specific therapies can help you deal with the side effects of radiation?
Yeah, so radiation is very serious. So usually when we have a patient that needs radiation, so I tell them, one, if you're going to do radiation, make sure you do a couple of things. One, I give the patient superoxide dismutase. So inside our cells, we have a natural detoxification system called SOD. It's our internal garbage enzyme. And so you need to take extra amount of that because you're going to be exposed to radiation, which is a toxin, all right? And so I usually give 4 SOD 3 times a day. Now, I always tell the patients to get oxygen therapies because oxygen makes radiation work 50% better. Plus, it also helps you with the toxicity of the radiation. I also give the patients Epsom salt baths to do at home, Epsom salts with baking soda and clay. And then I have them do coffee enemas. So the other thing about the radiation, it really affects the immune system. So make sure you're taking something to fortify your immune system. You can use the beta glucan. We use something called Protactival, and we use something called BRM3. We also use something called Empower. So all those things, any one of those things would be beneficial for helping your immune system because radiation has it takes a long time to get the toxins out of the body from radiation. So it's always, if you're going to do radiation, which in your case you may have had to do because maybe you can't walk or maybe the cancer is very large. I don't know your particular situation, but the bottom line is that you you got to protect yourself when we do anything that has negative forces against the human body and or side effects. And we know radiation has side effects. So
Okay, so the one. Yeah,
so
so you want to read
do
it?
you have
Yeah.
facility and recommendations in the Bay Area? Hubby was diagnosed with colorectal cancer in 22. Life has been hard. We both try to avoid stress. Having this type of cancer is stressful. That's very true. We pray and read our Bibles. Super excited. By helping the pain, having to be in the bathroom. I hope you're getting care. You may be doing, you may be doing, Eziac. Eziac is really good for your immune system. Or please send help. Okay, so there is a doctor, Avi, and he is in San Francisco area, and he does treat cancer. So he was a cardiologist by trade and then found functional integrative medicine. And he is somebody that you could go see that is very similar to me. And that might be helpful. I don't know anybody else up in the Bay Area that does integrative oncology, really don't, other than him. So we can put his name in.
Yeah, Sid.
Sydney put his name in that for a lot of people from the Bay Area visit us. So yeah, they come and visit us. So
no question. And this is going back to that 4 pillars where the right testing is done, starving it, killing it with the right approach based on the testing, and then supporting and fixing causes. If that is done, I know that's a generality, but if that's done, that's when the upside is significantly increased. So follow that plan and then try to maybe Dr. Avi will be able to help with that plan, and you're going to have your husband will have a much better, a better chance to fight the fight and be healthier through the process, less pain, etc. So
right.
I know it's general, but that's the idea.
Yeah. So, and I don't know what stage, or
Right.
I don't have any specifics or anything. But there's
people.
So
Yeah.
just look up he's in the Bay Area, Dr. Avi Urshowitz.
All right, we'll definitely put that on. I'll have Sydney put that, get that out to you for sure. Okay, so SOT, therapy, side effects, also whether ozone is effective against cancer, in your opinion.
Right. So our institution has been doing SOT for 10 years. It's actually 10 years in August. And so when I first read about SOT, which stands for supportive oligonucleotide technique, I said, oh, wow, sounds amazing. And so then, we started using it, and I've been using it ever since. And so, first of all, it's the only personalized cancer therapy or treatment in the world. That's number one. Number two, it takes your circulating tumor cells, reverse engineers a new messenger RNA to disrupt the DNA of the cancer cell. Now, there is an SOT for viruses also.
Lyme.
So, and Lyme. So, but in this, we're talking about cancer right now. So the blood is drawn, it's sent to Switzerland or Greece. They make the SOT, and it takes about a month to get back. And then we administer it, which takes about an hour and 15 minutes. And then that has a killing effect for 4.5 to 5 months. Now, I rarely have ever had a patient have a side effect. I will tell you an instance where I had a patient who came into me, had a diagnosis of tongue cancer, like 5 years. And he was having a dentist inject ozone into his tongue. And so when I did his history and I did all of his exam and everything, and I'm like, wow, I don't see anything in the tongue. This is pretty amazing. So he had been getting ozone injections into his tongue for about 4 years. So I said, well, let's order all your blood work. Let's order a PET scan to make sure. His PET scan came completely clear. And so then I had ordered circulating tumor cell test and got those. And then I said, you're going to be the perfect candidate for SOT because you don't have any tumors anywhere. So we ordered the SOT, received it, administered, and in 48 hours later, he is at my nursing station saying, oh, no, I can't talk. Anyway, so because what it did is attacked all the micro metastases that a PET scan can't pick up, because a PET scan only picks up lesions 5 millimeters and up. And so anyway, the bottom line is he did fine. It took about a month for his mouth to not swell, but it actually attacked. So it was good for me to see it because I was like, oh, well, this works so fast.
Yeah.
So I was happy, not happy for the patient, but happy that in 48 hours, that is already working.
Mm.
So again, like I said, it has a killing effect for 4.5 to 5 months. So I use it on a regular basis, especially on young people, because young people cancers are very aggressive, and I want to get their circulating tumor cells down really quickly, because when you're young, the DNA is rapidly dividing compared. That's the only benefit of being older, is DNA is slower in its production. So anyway, and if we have like a patient with a high Ki-67, that's the proliferative index of the cancer cells. So if it's high, ideal is less than 10%, then that's another reason I will tell people to do SOT. But I think it's a fabulous treatment.
It does the cleanup.
Yes,
It does the
exactly.
cleanup.
Yeah. And you wanna be well faster rather than slower. Okay. Now, the EBU we've been doing now, for a couple years. It's not specifically for cancer. It's specifically utilized in our cancer patients, because when you have a cancer patient, they usually have many things going on that we have to fix. So it's great at changing the terrain of the body. So it's getting rid of bugs, it's cleaning, the blood goes through a filter. I know Dr. Roney and Tanner did a whole special on EBO, and you can go back and look at on YouTube that particular cancer conversation. And so it's great. So we did an internal study in our office, where when patients did 3 EBUs and 2 chelations, there was so much that was done and cleaned up in just those 3 sessions with EBU and chelation. And so it really is effective in immediately changing the environment for the cancer patient. Plus, ozone is very helpful for the immune system and killing bugs, viruses, bacteria, and fungi, and a few parasites. Not all parasites, but a few. So it is an amazing treatment that, at least you should have something like that once a year would be a good idea. But on our cancer patients, it's synergistic with chemotherapy, and also helps neutralize the toxicity of the chemotherapy when they are getting chemo. So it's not a directed treatment against cancer. It's to help change the garden and the terrain that the cancer came in. So
it's a tool in the toolbox for sure. A great one, by
right.
the way. All right. Best supplement suggestions for cancer prevention.
Well, first, the most important supplement is a PMA, positive mental attitude. That is the most important supplement every single day, is to really set your mind. And because we all are living in our subconscious, 95% of our subconscious. So that means we have recordings in our brain that from in utero to the age you are now. And unless you've done lots of work, emotional rewiring, and as Bruce Lipton, who's going to be on our cancer conversation in October, he's going to talk to us about how you think. You become what you think about most of the time. So if you think you're invincible, limitless, and unstoppable, that's what you become. So I would say setting your mind and resetting it through the day, and before you go to bed, make sure you go in a peaceful place when you go to bed. And so that would be the number one thing. Okay. And then if you've had serious trauma and drama, make sure you've partnered with someone to have emotional attunement and to turn those unfavorable emotional experiences into something favorable. So we do EVOX in the clinic. There's EMDR. There's all kinds of different things. Maybe you do a life coach. There's all kinds of things that you can do to help support that, the way we think each and every day. So that's number one. So I would say the number two thing as far as supplement and supplementing would be vitamin C. So vitamin C is the antidote to everything. So we use 3 different kinds of vitamin C here. We do Vitality C, we do liposomal, and our new latest greatest C is micelle C. So micelle is literally a micelle. It's a delivery mechanism to bring the supplement straight to the cell and very fast to the cell. So, so vitamin C, every human, every baby should be on vitamin C because it's the antidote for toxicity, antidote for bugs, antidote for heavy metals, and helps the immune system. Look at the work of Linus Pauling, who invented the chemical, got a Nobel Prize for inventing the chemical bond. But vitamin C is your best defense for anything and everything. The other thing that's very helpful for cancer prevention is pancreatic enzymes. So your pancreas is supposed to make pancreatic enzymes, but as we age or our body is under attack, like look at all the people who are pre-diabetic and diabetic. So that means they don't have a highly functional pancreas. And so we have now also fatty liver, but we also have fatty pancreas. And so pancreatic enzymes do clean up. They clean up garbage in your body. So supplementing with pancreatic enzymes is there's a very, what I teach the doctors is read the book, One Answer to Cancer. And he was a dentist who got stage 4 pancreatic cancer young, and he cured himself. And one of his many things he did, again, Dr. Roney said, there's many things you have to do to fix yourself. The human miracle is a miracle. So miracles don't take one thing. They require many things, lots of intentions and attention to the intention. So, if we're all taught this from birth, it would be a lot easier. But anyway, so pancreatic enzymes. And then after William Kelly, Dr. Gonzalez, who died, I forget now how long ago, his wife, I know his wife still, but he died 5 or 10 years ago. We don't know how he died. But anyway, bottom line is he used, many pancreatic enzymes. So if you look at the work of Professor John Beard 100 years ago, and he determined why pancreatic enzymes work. And so when the mother gets pregnant, she makes a placenta. A placenta is a foreign body. The mother makes pancreatic enzymes so she doesn't reject the placenta. And at 6 weeks in utero, the baby starts making pancreatic enzymes so that the placenta is able to stay there and supply the food for the baby. So pancreatic enzymes are really, really important. One of the first supplements I learned was Wobenzyme. And that was because it was a prescription in Germany. Now it's sold, I think, over the counter. But pancreatic enzymes are great at keeping your pancreas healthy, but also cleaning up the garbage in your body and helping prevent cancer. The other thing is D3. So making sure you have adequate D3, probably 5,000 international units. All right. Now, when Dr. Roney does his oligoscan, he will tell you the common things that everyone is deficient. So if you're deficient in one or more nutrients, you're going to be predisposed to cancer. So
yeah. So when we're looking at the oligoscan, which looks inside the cell, so it's intracellular nutrition, we're looking at 20 trace minerals. We're looking at vitamin A, C, D, E, vitamin B6, 9, and 12. And so what we see consistently is low magnesium. We're going to see low, believe it or not, we see low silicone a lot because aluminum blocks the absorption of silicone. We see low phosphorus, we see low calcium, we see low, I mean, there's very common things, and iodine is low consistently as well. The point Dr. Connealy will make is we need to be able to look inside the cell. A lot of the testing will look at the plasma,
And
which is
serum.
extracellular, where the oligoscan looks inside the cell. So I always use this easy analogy. It's like we could have all the magnesium we want in the blood. If it can't get into the cell, we're still cellularly deficient, which means we're going to have dysfunction within that cell. And a lot of times the mitochondria, which is the powerhouse of the cell, that's a big part of cell health and cell communication, is going to be deficient or depleted, which was going to leave us more prone environmentally.
Susceptible.
Yes, susceptible to cancer.
Yeah, because
right?
mitochondria
Disease.
is how to protect yourself.
Exactly.
Okay? And the mitochondria require tremendous amount of attention. So if you want to learn anything in your body, you want to study the mitochondria.
Exactly.
One of my mentors 25 years ago, that's one of his big pet peeves with me is mitochondria. So they make the currency of life, ATP. So if you don't have good mitochondria, which you inherit, believe it or not, from your mother, so you want to make sure if your mom was healthy, she probably had good mitochondria, but you want to preserve your mitochondria. And what attacks the mitochondria every day are electromagnetic fields, heavy metals. Dr. Roney was saying the aluminum, and it also picks up on, but we all have heavy metals in us. I did when I first did my oligoscan. I did. So I take chelation every day. I take tons of minerals because I go 100 miles an hour. I take lots of minerals. In fact, I have my ketone water right in my pocket because I took some in the morning, and then I usually take it later on in the day because you're a 24-hour machine. You're not just a 12-hour machine.
Has 72 trace minerals.
Yes,
exactly. It's one of nature's.
It's the beautiful thing in the whole world. So anyway, so minerals. You can't, the food supply doesn't have, plus we're all under lots of external stress, they call it the cell danger response. So our body is just constantly now, we're not in nature. We don't get sunshine. We can't have foods that have the nutrients anymore. We're under EMFs and so many toxins and so many EMFs and so many heavy metals. So unfortunately, this is the new normal. Okay. Yep. And you can read, I can give you any reference you want on about this. So again, having the right nutrients for your body is how you prevent cancer. Dr. Roney mentioned iodine. So I personally take iodine. I take it topically and orally because every cell, one of your cells needs iodine. Your thyroid needs iodine. Cancer cell death is promoted by iodine. So being deficient again in one or more nutrients will create the environment for cancer. Yeah, so that's why we check to make sure, because every doctor goes to medical school and they learn the Krebs cycle of energy. The Krebs cycle of energy is all about the nutrients creating energy for you. So all doctors learn this in medical school when they take biochemistry. So,
and I'll throw in one just quick one quick point. The individuality, right? So oligoscan individualizes the care, right? If we did, I talked about epigenetics. I think the epigenetics are very significant because if you're not, breaking down these inflammatory cytokines or proteins properly because there's an epigenetic factor going on, or you're not methylating well or detoxing well, sometimes we can look at that panel, those panels, or a panel like the oligoscan and dial it in specifically to you, the individual. And I think that is a significance of importance because we're all a little bit different on how we handle the environment around us.
Right.
And a lot of times those individual tests can dial us in specific to you that maybe somebody else doesn't have a problem with, like the SOD1 epigenetic factor that, you need glutathione to break down hydrogen peroxide. That's specific, but That's what happens though. And then we can go, oh, you have this gene mutation as an example. You need these things to start breaking this stuff down. And now you're less susceptible. So the individualized approach is good too for these things.
Right,
Yeah.
exactly. So there's every individual's an original. So you've got to get individually tested, and then you do what, you do what we find.
Yeah.
And that's the best way to correct it. And so,
Yep. Agree. All right, supportive therapy, therapies for patients, if not working with someone, for example, sauna, cold plunge, etc.
right. So all of those. So we give our patients, if you have sauna, absolutely do sauna. Sauna is one of the most powerful things for self-protection, and or if you're having if you're undergoing treatment. So sauna is amazing. Cold plunge is amazing. If you're scared of a cold plunge, do a cold shower for 30 seconds or 20 seconds or however long you think you can. But a lot of times patients say, I did 20 seconds. I got that down.
Yeah, exactly.
And then I tell, okay, go to 30 seconds and then go to a minute. But it's amazing what that can do. And then baths, like you could do an Epsom salt, baking soda, clay bath. That would be wonderful. Getting sunshine every day would be great. Grounding every day, that would be wonderful. Make your lymph work. You can do it with skin brushing. You can do that at home by yourself. Then make sure your sleep, your day starts when you go to sleep. So make sure you get a good night's sleep. Go honor your circadian rhythm, which is 10 to 6, give or take 30 minutes. Make sure you're drinking purified water, not from your refrigerator and not from your tap. So make sure you have, purified water, and you can get something on the counter or something, but you have to drink purified water. And then you need to eat foods that nourish and strengthen and heal your body. Real food, not fake foods, not packaged foods, but something real, food that is real, that it has nutrients in it. And then you've got to move your body, because when you move your body, you move your lymph, you get oxygenation, you make chemicals that make your brain work better, your circulation, everything works better when you move. I mean, I would say that's the biggest thing. I try to move anything. I enjoy washing dishes because I'm exercising. I enjoy washing clothes on the weekend and stuff. So, because I just look at every opportunity to move all the time. So. And then you can do castor oil packs on your liver. One of my patients tonight from Australia, right? I was late because she's from Australia, so she wants to capture it down every last minute. And so anyway, she came here to visit us, and she did the whole protocol that she has a history of breast cancer, but she came to do all the couple of days, and she was telling me, so what happened is, she developed hyperthyroidism, and her doctor gave her a drug to get it. And so I said, when you get home, I'm going to give you special essential oils and a castor oil pack. And she's like, Dr. Connealy, I did that once, and I swear it completely changed my thyroid. And she goes, I went and got checked to my endocrinologist, and now my thyroid, I've off all the drugs. So she's doing that once a week with castor oil, and
they pulled some of the junk
out of the thyroid. Anyway, she's like, I can't tell you. I feel so much better now that I'm sleeping, because when you have high thyroid, you can't sleep and you're super hyper and you're miserable. So anyway, so those are wonderful things to just do if you're not working with someone. And all of these are in my book, The Cancer Revolution. And my next book is coming out in 2025, Cancer Revolution Part 2. So.
Okay. Prepare for and detox from surgery.
Yeah, this is a great question, because most people just go in and do their surgery. First of all, they go in and do their biopsy. So you should never do a biopsy not prepared. You shouldn't do surgery not prepared. So our protocol for a biopsy, because what is a biopsy? It's an invasion into the body, okay? They give you anesthetic. They puncture something. It creates this whole cascade of reactions in your nervous system in your body. So you want to be in a cancer killing mode, fighting mode, if you're going to have a biopsy. So we give our patients vitamin C, Tagamet, modified citrus pectin, and pancreatic enzymes minimally for a month if they are to do a biopsy. Now, for surgery, it's very similar, except we like to have our patients do IV vitamin C for a week prior to surgery with hyperbaric oxygen before and after surgery with those same supplements. So, and then the most important thing is the mental emotional component. So I had 5 years ago, I had 18 hours of back surgery. So I prepared for 3 months with hyperbaric, lots of mental work with meditation, how great the surgery was going to be and everything. And I did IVs and nutrients and all that. And it wasn't for cancer. It was, to correct my scoliosis. And so anyway, so I've been through it. So I know what you have to do. So I prepared 3 months because I had plenty of time to plan this whole surgery and everything. So yes, so that's what you want to do to prepare for surgery. So that is a great question. Thank you for asking that question.
All right.
So Tom,
It's toxic invasive to the body.
yeah. So yes. So yeah, if people saw the breast implant removal, they would never get breast implants. Okay. So a couple of our staff have had their breast implants removed and they show me the video. It is not a very pleasant video. It's not the implants they show you that they're going to put in the body when you do the breast augmentation surgery. It's the implants afterwards where they formed a scar and they have mold. Usually, a lot of times it's mold growing on them. It's not good for your immune system. I would say, yeah, what?
It's foreign.
It's a foreign body. Yeah. So I would prefer that you not do breast implants. And I would say that almost every patient I see now is getting their implants removed. So I would say that is one of the most common things we see is removal of implants. So, and there's a great group online called Breast Implant Illness Group. And so, I think, I know some people had them for a long time, but they're probably, not the ideal thing for you.
When you're talking about gasoline to the fire, right? The fire would be the inflammation in the body. It's another gasoline. And so it's foreign. And then like Dr. Connealy mentioned, it could have mold and some toxins and things like that kind of form around it. And it's really just an area of the body that the immune system looks at and can say, that's not normal. So I'm going to attack it. And then a byproduct of that attack is this inflammation, which is where the illness comes from. Because you're chronically inflamed, it's going to affect your energy levels because the mitochondria is going to be affected. And you're going to have these elevated proteins, these inflammatory proteins, which affect your muscles and your joints and brain and everything else. So a lot of the symptoms will come from the gasoline that's being dumped on the fire, basically. So hope that helps, but that's the gist of it, right?
Right.
Okay, hydrogen water while doing ozone therapy, or do they cancel each other out? Since O3 is an oxidant and hydrogen water is an antioxidant.
Yeah, so I'm just drinking hydrogen water now.
Yeah.
And hydrogen water, everybody should be drinking hydrogen water. We have hydrogen water bottles here that you can make. You can also use tablets. So we have a water bottle, we have tablets, and this one I grabbed because it was quick and fast and I needed to drink it right now. So this is the ultimate antioxidant. We have all of our patients do the AquaCure also, which is hydrogen water that they breathe into their lungs. So now with O3, when you're doing ozone, you're just doing ozone. Okay. So ozone works completely different than hydrogen water. So they're not going to cancel each other out because you're only doing ozone for that hour. Usually it's about an hour.
Right.
All right. And so you're flooding the body with, so it's probably going to be good in the cleanup with ozone.
Mm-hmm.
So there should not be any issues with doing it at all.
So when they talk about an oxidant, there's levels that are used as well that actually turn on the good pathways, the anti-inflammatory pathways, right? The NRF2s, NRF1s, NRF2s. Whereas if you do use too much ozone, it can turn on the NFKB pathways, which are the inflammatory pathways. Right. As long as it's used properly, it's gonna do the good things, not the bad things. So it can be an oxidant, and that's more at high levels, right? That's the hormesis concept,
Right.
where if you do something too much, it can turn into an oxidant and create oxidative stress. It will create a little, but then the rebound is the body responds, and it pretty much evokes some of these good pathways. So yeah, I read that one. I didn't think it was an issue whatsoever.
Right.
So all good on that. Okay, so let's see. Does your clinic do photodynamic therapy? And if so, how effective is it on tough squamous cell throat cancer?
So we do photodynamic therapy. A lot of our practitioners have taken classes and lectures with Dr. Weber. You can go to on YouTube. Dr. Weber has lots of different YouTube videos on different things. It is amazing for skin cancer. So a squamous cell or a basal cell cancer, it's amazing. Instead of cutting and creating scars and all that, this is amazing. So we use it topically. So we give you a cream called aminolevulinic acid, and then we wait 3 hours, and then we use the laser to activate that pathological tissue, and it does, and it heals beautifully. So it works great for that. Now, for squamous cell throat cancer, I don't have enough information here to know, like, do we need to use it topically?
Right.
Do we need to use it? It probably in some way beneficial. Now, here in the clinic, we do it intravenously because there's 5 different lights that are used intravenously. So light is life. And then we use it topically. Now, I don't know your particular case to really,
Whether they can actually.
yeah, like if I would need to look at your particular situation and look at your scans and everything. And then you want to make sure, is this an HPV component? Because over 50% of head and neck cancers have HPV as a result. So you want to be killing the virus that's contributing to the inflammatory aspect of the squamous cell throat cancer. So, so I would need much more information to make a, decision on your particular case.
But it'd probably be something like this potentially with some of those other
treatments.
Yeah, other treatments that would combine layer the arsenal, if you will, the ammunition, and that tends to work really well too. So okay, so skin cancers, biopsy. What do I do to stop getting them? Basically, I had skin cancer biopsies within the last 3 years, had colon cancer surgery, and dealt with giant cell arteritis, temporal arteritis with prednisone and Simlab, right? Fighting cancers and taking immunosuppressive drugs for autoimmune disease. Sounds like a losing battle. Any advice?
Right. So you need an entire system overhaul. Okay.
Right.
And so because basal cell, squamous cell, you should be on high dose vitamin C. All right. And lipoic acid is very important for your skin. So, and then instead of getting more surgeries, I just talked about the photodynamic therapy, because more surgeries leaving the scars is not good. So that will be a great option. But skin grows from the inside out. So, and skin growing from the inside out isn't just one thing. It's many things. It's your hormone levels, your inflammation levels, your toxin level, your heavy metal levels. I mean, all of these things. So, so definitely we need to address all your nutrient deficiencies. And then you had colon cancer surgery. So we need to make sure you don't have any risk factors for the colon cancer coming back. And then you have giant cell arteritis, which is basically like an autoimmune condition. So there is so much going on here that we need to, this will take probably a while we got to unravel all this. So your body gets in homeostasis. It's not in homeostasis right now. So and everything is interlinked. We're basically one cell proliferating into 50 trillion cells, and they're all in community, in harmony. And we got to create that community and harmony in your own system. And that is getting rid of all the bad things, getting all the good things, and getting the mind in the right, beautiful state of harmony and synergy. And, you can, this, because prednisone is terrible on the immune system. the tocilizumab is terrible on the immune system. So you're just trading one problem for another problem instead of really getting your terrain, the garden, the foundation of your body super healthy so these things don't occur.
Yeah, you using that fuel and fire analogy, there's a lot of gasoline being dumped on the fire. It could be bacterial loads, viral loads.
Yeah.
It could be candida,
many
parasites,
parasites,
toxins, chemicals, mycotoxins from mold, the stress component, the hormone component, the EMFs, the epigenetics. I mean, all this are things that we look at, or what should be looked at, I should say, to be able to start getting rid of some of these underlying factors that is creating the cellular dysfunction. There's a lot of cell dysfunction going on, but there has to be a lot of these causes contributing to it. So it's a multifactorial issue. But with that, having said that, if we can support the cell like we talked about with oxygen and immune boosting therapies, and we can charge the cell and we can get the cellular environment more nutritionally sound, and then start getting rid of some of these causes, that's when the tide will turn. That's when we could turn this whole thing around. So,
Right.
Yeah.
Yeah. And so the doctors are responding to a diagnosis.
Right.
So the worst thing for you is to have a diagnosis of anything. So
Right.
every doctor should try to be de-diagnosing you and healing you and fixing you.
Yeah.
And
Great
they're
point.
just throwing right now, okay, we got to do this and we got to do that, but they're not taking care of how the body works and honoring the incredible systemic order that the body has.
Well, it's a great point. We talked about this last time, that the actual diagnosis is cellular dysfunction.
Right.
That's the diagnosis created by metabolic dysfunction in the body. That's really what should the diagnosis should be.
Right.
The cancer, if you will, is just a way for doctors to communicate, right?
Right.
And it tells us that, okay, these cells have now mutated and replicated, but it's really the cellular dysfunction. So if we get that cleaned up and get the metabolic dysfunction in the body working really well, you've got it. You know, at least you have, again,
Right.
setting yourself up for the best opportunity for health and healing.
Because the doctors, this isn't going to work forever.
Yeah.
So
It's kind of treating the result of the problem, but not necessarily the cause. All right, last question, because I know we're definitely getting into 6:30-ish. So when in remission, why do I sometimes continue to get parasites, EBV, which is Epstein-Barr, before I got cancer? Did I have any of these issues?
right. Well, you don't know you didn't have any of these issues because, the best way to look for Epstein-Barr is doing a serum titer. So if it's high, which literally almost everybody has,
Yeah.
and viruses are either asleep or awake. So we got to make sure those are asleep. And then parasites, also very difficult to diagnose parasites through a blood test, stool test, or any test. The only way is to do it bioenergetically. And so there's a Dr. Yu in Missouri who teaches doctors all over the world, and that's who taught us. And you have to do bioenergetic testing because there's over 500 species of parasites. And if the parasites are in the head or in the liver, they're not going to be in the stool. And so you can't do parasite testing by doing a stool test. So also, if you still have lots of garbage in your body, heavy metals and toxins, you're going to grow yeast and parasites. Also, the biggest assault we have on us today is electromagnetic fields. Make mold, yeast, and parasite and viruses, all bugs grow. So we're all into that. So I personally take chlorine dioxide every day because chlorine is ClO2. It's been around for 50 years or 60 years. And I went to a course 20 some odd years ago, and this doctor was talking about it. I'm like, oh, I got to learn about this. I don't know. So I started doing it. That's what I personally do every day. I do take Para-1 for parasites. It's Mimosa pudica. So I take that. I went off of it and I got the parasites like a month later. I'm like, I'm done. I'm tired of this. So I just no, I can tell I've had parasites over the past 10 years. And I'm like, no, I'm just going to prevent because it's just easier to prevent. So, chlorine dioxide kills viruses, bacteria, and fungi. And it's not bad for you. It cleans your blood. It's very, very effective. And parasites are not as easy.
Yeah.
They're not as easy to get rid of. And because there's so many life cycles and they're inside your cells. They like being with you. So it's not so easy. So I believe that unfortunately, the world we've created today in 2024 is really not a favorable, existence. And many doctors that are older talk about how civilization is, killing humanity. So, which is true. So,
And then the remission part, there's a possibility if you did say chemo or something more aggressive, that it created
the environment.
it created the environment for these things as well, which again is why Dr. Connealy, with the plan that we've created here, supports the immune system through chemo, supports the terrain, because we know there's downside to it. There's upside, right? We get it, but we want to mitigate the downside as much as we can with all that supportive care. So that definitely breaks the immune system down, it breaks the body down, and it just leaves you a little bit more susceptible to those things as well. So that could be a part of it as well.
Right. Well, thank you so much for being a part. We'll take these questions for next time.
We'll definitely do
our next cancer conversation. So please, guys, thank you so much for being part of our mission, because we would like to reach 1 billion people with our knowledge and true information to transform the future of health and humanity. So thank you for being part of it. Make sure you share it with your friends and your family and other loved ones so that we can create a healthy America.
It's a movement, gang, right? So this information, we always say it's an injustice that the information isn't common knowledge in all healthcare paradigms, right? So our job with the cancer conversation, among other things that we do, is to get the word out. So everybody at least has the information to make an informed decision if they have a diagnosis like this, that they know they have other options, just more than that one chapter of the book, right? And we're convicted in that. I mean, everybody here is very convicted in just getting that information out. So we always get questions, and I repeat this. So if you're interested in coming to the clinic and you have active cancer, or you've had it recently, you're looking to prevent reoccurrence, Vicky downstairs, 949-581-4673, or Hope, is who you would contact. She's very good, very, very mission-based, very sweet, will help you in any way she can, for sure. As far as if you're prevention or working on autoimmune or some of the things that we mentioned, the Center for New Medicine side, and that's Miles, who also really, really good onboarding patients, 949-680-1880. We have the hyperbaric oxygen center here too. So that number is the 1904 number. So 949-680-1904. Kyle's pretty much a guru with this stuff. So he's well trusted. And then if for the supplements, a lot of supplements were mentioned. So I do want to mention this. You have the Perfectly Healthy store,
direct line.
And then the website there is the perfectlyhealthy.com. A lot of these are on that website. And so the direct line is 866-616-7474. So at least you have resources if you need them. Okay.
And communicate with us. Let us know.
Yeah.
Anything you want to hear about, your questions and everything, we're here for you.
Definitely a good dialogue. We like the dialogue. So, okay, y'all, have a great couple weeks. We'll see you in 2. And then if you need anything, just reach out. Okay. Much love. Bye, everybody.
Bye-bye.